The SAM Pelvic Sling 2. Its new one-piece design is easy to use, with application now in just 3 basic steps. The SAM Pelvic Sling 2 is the first and only force-controlled circumferential pelvic belt designed to provide safe and effective reduction and stabilization of pelvic fractures. Users of the SAM Pelvic Sling 2 include both civilian and military emergency medical services, hospital emergency departments, search and rescue personnel, and wilderness and remote medical providers. Pelvic ring fractures are among the most serious of all musculoskeletal injuries. The mortality rate for complex pelvic ring fractures is reported to be 25% or higher. This mortality rate increases in the elderly and in the presence of shock. Physical examination is often inaccurate. Average blood loss can be as high as 2 to 3 units per break. Early control of life-threatening hemorrhage is the primary goal in the emergency management of pelvic ring fractures. The application of circumferential compression with a pelvic belt can significantly reduce and stabilize pelvic ring fractures, decrease hemorrhage, and lessen the need for pain-relieving narcotics. The SAM Pelvic Sling 2 is a lightweight, durable, and effective force-controlled circumferential pelvic belt. It is available in 3 sizes: small, standard, and large, with the standard size fitting 98% of the adult population. It is the only pelvic belt or binder to feature a patented buckle designed to engage when the correct, safe amount of constrictive force is applied. This buckle cannot be over-tightened, providing an added measure of safety when the sling is applied on scene by all levels of trained EMS personnel. The anterior section of the sling is sufficiently narrow to allow for examination, catheterization, and access to the femoral vessels. Anterior external fixation can be applied without removing the sling. Also, the belt portion may be trimmed in certain areas if access is limited. The sling is padded for comfort and is radiolucent except for 2 small precision coils. Before using the SAM Pelvic Sling 2, you must read and practice the instructions for use. These instructions are attached to every pelvic belt. The SAM Pelvic Sling 2 is comprised of a soft padded belt with a plastic buckle attached to one end. This unique patented buckle is designed to engage when the correct constrictive force is applied to the belt. Next to this buckle is a loop of strong fabric sewn to one end of the belt that acts as a fixed pull handle. A plastic slider on the back of the belt is designed to allow the belt to easily slide along the surface of a backboard. The opposite side of the SAM Pelvic Sling 2 is a strip of perforated black webbing with a loop handle on the end. This handle is referred to as the free pull handle. One surface of this loop handle contains Velcro hooks designed to strongly adhere to the outer surface of the pelvic sling. Before applying the SAM Pelvic Sling 2, check the patient's clothing, belt, and pockets for any hard objects, such as a cell phone or keys. Next, locate the bony prominences on the side of the hips called the greater trochanters. These prominences are generally at the same level of the symphysis pubis and buttocks. This is the correct level for sling application. After you have located the greater trochanters, place the unprinted side of the belt under the knees and gently position the buckle off-center. With your hands beneath the lower buttocks, gently lift the patient approximately 1 centimeter. Then slide the sling up to the predetermined level. Check again to ensure that the sling is centered over the trochanters and the buckle is off-center. Next, insert the webbing through the buckle. Then grasp the fixed pull handle on the other side of the belt and pull the 2 handles in opposite directions. Pull until you feel or hear the buckle click or stop the belt. When you determine that the buckle has engaged, do not release tension. Maintain tension and firmly press the free pull handle against the belt. The Velcro hooks on the surface of the free pull handle will secure it in place. Do not be concerned if you hear a second click sound after the sling is secured. To release the pelvic belt, lift the free pull handle away from the belt and slowly release tension. Please note that the SAM Pelvic Sling 2 should be removed only under the supervision of a physician. This product is not recommended for use on children. The SAM Pelvic Sling 2 should remain firmly attached to the patient while in the MRI room. Again, here are the key application points. Always apply the SAM Pelvic Sling 2 at the level of the greater trochanters. This is typically at the level of the buttocks or symphysis pubis. Do not apply around the waist. When tightening the belt, pull until you hear or feel the buckle click or the belt stops. At this point, do not release tension on the free pull handle. Maintain tension until you secure the strap by pressing the strap down on the surface of the pelvic sling to engage the belt. The SAM Pelvic Sling 2, the first and only force-controlled circumferential pelvic belt designed to provide safe and effective reduction and stabilization of pelvic fractures. Available in both civilian and military colors. Thank you for watching this video on the application of the SAM Pelvic Sling 2. More information, including research studies, clinical reports, fact sheets, and testimonials, can be found by visiting our website at www.sammedical.com. This video can also be viewed at this site.